Hello, my name is Stephanie McGrath, and like you, I am a dental hygienist. As dental hygienists, one of our most important jobs is to help our patients maintain good oral health throughout their lifetimes. We educate our patients and recommend the treatment that will benefit them the most. But one area that's often overlooked during the hygiene appointment is malocclusion. During this video, you will learn how malocclusion can affect your patient's oral health, how to educate them about the potential consequences of untreated malocclusion, and how to discuss Invisalign as a tool for improving your patient's oral health. Many hygienists think of Invisalign as a cosmetic protocol, helping patients achieve more attractive smiles. But when you learn more about the consequences of malocclusion, you'll begin to see teeth straightening as a valuable treatment path to help your patients maintain their teeth for a lifetime. This video is a valuable resource you can turn to over and over again. First, watch it from start to finish for a solid overview of the information. When you're finished, you'll receive 1 hour of CE credit. Be sure to collect that credit by logging onto our website and taking a brief test on the material. Keep the DVD handy so you can turn to it at any time to access key sections for focused study or review, and to take advantage of the additional resources in the extra section. We designed this DVD to be as practical as possible. It features 2 respected clinicians who share real-world insights and experience you'll find useful in your daily practice. Dr. Robert Boyd is chairman of the Department of Orthodontics for the University of the Pacific, Arthur A. Dugoni School of Dentistry. He is also a periodontist and has focused his clinical research and publications on the relationship of orthodontic treatment and periodontal health and aesthetics. Dr. Mark Hodge is a general dentist who's remarkably successful at treating patients with Invisalign. He and his hygienist are great at utilizing Invisalign as a dental health solution, not just an aesthetic treatment. And they'll share some valuable strategies to help you diagnose malocclusion and present Invisalign to patients. While preparing this video, we also spoke with dozens of hygienists to get their real-world perspectives about malocclusion and Invisalign. We'll share some of their thoughts both during this hour and in the extra section of this DVD. We've broken all of this valuable information into 3 chapters for you. In the first chapter, you'll discover how malocclusion can impact not just your patient's oral health, but their overall health. The second chapter gives you the tools to discuss the consequences of untreated malocclusion with your patients. Finally, Chapter 3 gives you detailed steps and role-played examples to help you discuss Invisalign with your patients. So let's get started. Chapter 1, the connection between malocclusion and oral health. As dental hygienists, we know that the accumulation of plaque and bacteria typically leads to periodontal disease. We also know that malocclusion can result in occlusal trauma and abnormal wear on teeth. We see patients every day with the telltale signs: inflamed gingiva, periodontal pocketing, shortened, worn down teeth, and fractures. And you are probably aware of the recent research indicating that periodontal patients have a higher risk of developing other systemic inflammatory diseases. But did you know that key studies now show that patients with misaligned teeth are at greater risk for periodontal disease? Misalignment of teeth influences the development of periodontal disease, and that makes it worth a closer look.
Well, there's a number of instances where malocclusion or crooked teeth can affect oral health. One of the most important ones is when the teeth are significantly crowded, because if the teeth are significantly crowded, it's very difficult to floss and brush between the teeth. And so correcting the crowding can have a beneficial effect on the patient's ability to remove plaque with toothbrushing and flossing.
Well, just about any hygienist can tell you a mouth that has crowding or a mouth that has poor occlusion, the gingiva is going to be affected. Crowding obviously makes it a whole lot harder to keep clean, so inevitably they're going to have more periodontal disease in those areas. Malocclusion also causes gingival defects and, in turn, bone defects. So a lot of patients themselves don't realize the ramifications of that. So Invisalign really helps to take care of both of those. Now, most patients don't need to be told that crowded areas are harder to keep clean. They have a hard time keeping them clean at home, and they struggle with it. So a lot of people are open to doing whatever they can to open those areas up so that they can keep their teeth clean and healthy and inevitably keep their teeth.
In fact, studies show that anterior crowding can lead to increased risk of inflammatory processes. We've all had patients whose teeth are so crowded that it makes it more difficult for us to get in there and clean between them. If it's difficult for us, just imagine how much trouble patients have once they get home. You can begin to see where orthodontic treatment plays a role in helping patients have healthier teeth and gums. So we know good oral hygiene is effective in fighting periodontal disease. What's more, we also have the potential to help patients reduce their risk for heart disease and diabetes, maybe even help women have healthier babies. Misaligned teeth put many patients at even greater risk for periodontal disease and for developing other systemic inflammatory diseases.
I believe there is a link between malocclusion and periodontal disease. We see evidence by abfractions and gum recession. Also with malocclusion, we can see a lot of calculus buildup because the patient's not able to keep the area clean, which can also lead to gum disease.
Well, the dental community and the hygiene community have known for many years that there's a stronger and stronger relationship evolving all the time between active periodontal disease and systemic health. And some of the examples of this are people who have active periodontal disease have a higher incidence of strokes, and that there's even been studies that show that if you take care of the periodontal disease, these systemic problems can be decreased, such as heart attacks, strokes, and chronic lung disease. There's also a very strong relationship between diabetes and active periodontal disease. In fact, there are some studies today that are pointing to the fact that there may even be a causal relationship related between active periodontal disease and the onset of the diabetic experience. Finally, we also have a situation where recently Jeff Coate and others have shown that there is a relationship between preterm births, premature delivery, and underweight babies and active periodontal disease. And so this is, of course, a critical relationship for all of us to understand, be completely familiar with, and always be ready to advise our patients on the need to keep the periodontal health under control.
But crowding is only one example of how malocclusion can lead to other problems. Trauma and abnormal wear can also have a negative impact on a patient's oral health.
Another example is in the case of a large overjet where the upper incisors are more than 6 millimeters out in front of the lower incisors. Because especially for children and boys in particular who play sports a little bit rough, there are studies that show that there's a higher incidence of damage to the front teeth from basketballs or softballs or soccer balls hitting their teeth because their teeth are literally kind of out in front of their lip. Yet another example is in the case of crossbites. Now, crossbites are where there's a reverse relationship of the normal relationship between the upper teeth fitting outside of the lower. So in the case of a crossbite, the lower teeth are fitting outside of the uppers, in the anterior or the posterior. Now, in both of those cases, we know that there can be more wear of the teeth because the teeth are in a position that they really weren't designed by nature to have the best effect at preventing wear. And thinner surfaces of the teeth are present, and so we see adverse wear patterns with anterior and posterior crossbites.
If we can correct a patient's crossbite with Invisalign or another orthodontic technique, we're helping them reduce additional wear and damage.
Yet another example is a very deep overbite. And the very deep overbite has the potential where the lower incisors can actually contact the roof of the mouth and cause damage on the roof of the mouth. Now, of course, all of these conditions can be made worse by clenching and grinding because that would speed up the process of wear.
Let's talk about the hygienist's role in identifying and treating malocclusion.
There's a very important message that consistency of the entire office should be on the same page as far as preventive dentistry. The hygienist, of course, with their education and experience in prevention, can be the preventive dental managers for that concept in the office. And so the hygienist plays a critical role in actually informing the other staff members and working with the doctor to try and make a consistent approach to preventive dentistry. It's very disturbing if a patient hears from the front desk that, no, you shouldn't use that toothbrush that the hygienist just got done telling you to use. So consistency is the key, and the hygienist as the teacher making the consistency is the model.
Dr. Boyd's view of the hygienist as the preventative dental manager in the office makes sense. As hygienists, we certainly know the importance of acting as part of a team, working on behalf of our patients and what's best for their dental health. We should take the initiative to assess the patient's teeth and bite relationship. It's important that we understand how our patients' teeth look and function, and to understand our patients' concerns in order to best address them.
I believe it's important to educate my patients on the consequences of malocclusion because long-term health is really important. And so education is very key in helping patients with their long-term health.
So far, we've talked about the connection between malocclusion and oral health, and we've reviewed some of the different types of malocclusion and consequences of leaving those problems untreated, such as premature wear patterns and crowding that can make cleaning difficult. When patients can't brush and floss properly, they can suffer from periodontal disease. Studies have shown the link between periodontal disease and systemic conditions like heart disease, diabetes, stroke, and lung disease. So we're beginning to see the role malocclusion can play not in just patients' dental health, but their overall health as well. Now let's move on to learn some tips and techniques for talking to patients about malocclusion. Chapter 2, Tips and Techniques for Talking to Patients About Malocclusion. Now that you know malocclusion can be a big problem, it's time to think about how to communicate that to patients. As a dental hygienist, you probably understood this much more quickly than some of your patients will. They'll need your help to really appreciate the risk. Here's a look at addressing malocclusion in 5 simple steps. Step 1, perform an orthodontic assessment. In staying true to the idea of being your patient's champion for preventative maintenance and good oral health, you should always be on the lookout for malocclusion. Every patient deserves an orthodontic assessment. You're already looking for the signs and symptoms of periodontal disease. Now, look at those signs in context with any occlusal issues as part of diagnosing their causes. Signs of periodontal disease include gingival inflammation, recession, tooth mobility, and abscesses. Also, watch for signs of trauma and wear, including abnormal wear, abfractions at the gum line with exposed root surfaces, fractures, abrasions, loose, chipped, or missing teeth, and irregular gingival margins. Step 2, use digital images and visual props. Take intraoral photos to visualize the teeth and bite orientation. Use the photos along with Invisalign Typodont to be sure the patient sees everything that's going on with their teeth and gums while you explain it. The Invisalign patient case portfolio can also help illustrate a similar case and show the patient potential results. Visual props help patients understand the cause and effect relationships you're describing. When they understand how something works and why it's important, they're much more likely to accept your recommendations. Describe what you see in terms the patient will understand, and make it as easy as possible for the patient to ask questions. Step 3, follow the PCS model. You may have learned before about the PCS model for educating patients. PCS stands for problem, consequence, solution. and it's an extremely useful tool to help you educate patients. Here's how it works. First, outline the problem. I see you have some inflammation, particularly in the area of the crowded lower front teeth. Now that we've outlined the problem, explain to the patient the consequence of leaving the problem untreated. This is a very important step in making the patient aware of the condition and what could happen if it's left untreated. For example, with the crowding as it is, it's already difficult to get in there and brush and floss properly. Over time, that crowding may get worse, making it even more difficult for you to clean these areas. This can lead to more severe, irreversible periodontal problems like bone loss. Once you've explained the consequence, it's time to offer a solution. We really should straighten your teeth and make them easier to clean in order to help prevent more severe problems. Now you've offered the patient a solution. Now the patient understands what the problem is, what the consequences might be without treatment, and the solution that you're offering right now. Step 4, summarize findings in front of the patient. When you explain your findings to the doctor, the patient can begin to understand their importance. Doing so in the patient's presence allows you to both emphasize key findings and present a united treatment recommendation. You open the door to understanding and allow the patient to feel safe asking questions as part of a conversation about their health. Step 5, send the patient home with appropriate materials. Give your patient the tools to accept your treatment recommendations before they leave the office. When they get home, patients will typically forget most of what you told them and will probably minimize the importance of what you've said. So make sure to give them photos highlighting the problem areas you've identified, educational materials, and a written prescription for treatment. These serve as reminders and a clear message of what to do next. This way, patients are much less able to dismiss or forget your professional findings. Now, you may already be imagining how these steps work into your existing exam procedure. Once you practice with a few patients or by role-playing specific scenarios with your team, you'll have a seamless presentation that helps you become an even greater advocate for your patient's oral health. Let's do a quick review of what we learned in Chapter 2. We introduced addressing malocclusion in 5 simple steps. Hygienists perform an orthodontic assessment and exam, use photos and visual props, educate patients using the problem, consequence, solution model, summarize findings for the doctor in the patient's presence, and finally, send patients home with all the tools for communicating the problem and guiding the patient to make the best decision for their long-term health. Try to keep all these things in mind as we move to the next chapter. We're going to see these tools and strategies used again and again to help you envision how best to use them in your day-to-day interactions with patients. Chapter 3, Team Role-Playing. Now that you understand the potential consequences of malocclusion, we want to ensure you have the tools to successfully communicate with your patients. In this chapter, we'll share 3 role plays that give you ideas on how to handle patients with crowding, deep bites, and cross bites. We've also included additional modules for spacing, edge-to-edge bites, excessive overjet, and aesthetics in the extra section. Now, let's meet Dr. Mark Hodge, a general practitioner who has reached Invisalign Premier Elite status. He has successfully incorporated orthodontic treatment as a valuable tool in treating patients in his Tulsa, Oklahoma practice.
When I look back on my Invisalign experience, I realize it's been a progression. Early on, I think a lot like other dentists, kind of struggled in presenting this because I almost felt like it was an elective procedure, an elective aesthetic thing where if I wasn't careful, I almost sounded like a salesman, which just repulsed me. Once I really realized this is not an elective issue, and in my own mind, I settled the healthcare benefits of this treatment, Once it was settled in my mind, I could link it together in the patient's mind. So now my conversations are just about the health benefits. The aesthetics are a bonus. I don't see it as an elective. I am helping them prevent dental disease and dental expense. So why wouldn't I talk about it?
So you see, Dr. Hodge has embraced treating malocclusion with Invisalign as core to his practice. He has integrated Invisalign as a valuable resource to help patients achieve healthier smiles. The aesthetics, as he says, are just a bonus. His health-first approach makes him and his team extremely effective when it comes to explaining to patients the benefits of straight teeth. Dr. Hodge sees many of the same things you do in day-to-day practice. He'll share some of the ways he and his team present treatment issues and how they educate their patients about the consequences of leaving problems untreated. You'll notice that he and his team are well versed in the PCS model we discussed earlier to educate patients, help them understand the issues they face, and then make positive, active decisions about their oral health. First, let's take a look at crowding. It's more than just an aesthetic issue, because crowded teeth can make it difficult for patients to properly brush and floss all tooth surfaces. And of course, we know that difficulty in brushing and flossing can lead to tooth decay, plaque and calculus buildup, bone loss, tooth mobility, and abscesses. Patients may present with sensitivity, discolored teeth, bleeding or inflamed gums, receding gums, and bone loss. Crowding can also create improper occlusal function. If the teeth aren't in the correct position, normal vertical force is not transferred from the crown to the root and bone during occlusion. Instead, unwanted lateral stress is placed on the posterior teeth and surrounding periodontal structures can begin to weaken. Patients may experience occlusal trauma in the form of abfractions, uneven wear, and chipping. Gum recession and bone loss can progress, and overlapping teeth can continue to worsen if they're left untreated. Patients may notice small notches in their teeth at the gum line, as well as receding gums, loose teeth, and tooth sensitivity caused by wear. Watch now as Brandy, one of Dr. Hodge's trusted hygienists, approaches a patient about crowding.
Okay, Terry. Now that we've finished cleaning your teeth, I'd like to go over a few things that you had addressed on the health history. One of the concerns that you had marked was that you've had some fractured teeth before.
Yes.
Can you tell me a little bit about that?
Well, I think it's based on the wear of the tooth. I've had other dentists tell me that that's been the case just through the years, just the wear on the tooth. I don't know exactly how it happened.
Okay. And you also have a crown, I see, when I was
Yes.
looking in there. Was that tooth fractured also?
I'm not sure, but I think so.
Okay. Okay. All right. Well, commonly that's one of the things that happens is when a tooth fractures, you have to get a crown. But I did notice quite a bit of wear on some of the other teeth, and so in a moment we'll address those issues and how that could be corrected. The other concern I had was down in the lower front. You had quite a bit of bleeding, and when I was doing my probing today during the examination, I noticed that. And imagine it's pretty hard for you to clean down there because those teeth are pretty crowded.
Very difficult. It's hard for me to floss down there, so I tend to kind of avoid it.
Okay, all right. Well, with gum disease, that is the #1 cause of tooth loss is from gum disease. And I did notice some bone loss as well. And once that bone loss starts progressing, you can actually lose teeth. And so that's one of my concerns long term. And that's our job, is to help you think about what's going to happen years down the road and how we can help prevent that. Okay. So one of the things that would help to fix the crowding as well as make it easier for you to clean at home would be to do some straightening.
Okay.
And I'm not sure if that's anything that you've ever considered before or not.
Well, sure, if it would help. I mean, certainly I want my teeth to be healthy. If that would help, that'd be a good thing.
Okay, all right.
Absolutely.
Well, one of the recommendations and one of the newest technologies that we have is to do some straightening with Invisalign. Okay. You wouldn't have to have traditional braces, so that's the good thing. They're clear appliances. It's simple and easy to do. And if you'd like, I could tell you some more about that.
That'd be great.
Sure. Well, one of the things that we would do is take models and photos of your teeth. We'd send those to Invisalign, and they would make a series of clear aligners, and you would wear those, and each set is worn for about 2 weeks. So when you come in, we would give you 1 set to wear and 2 more sets to change into. And they're a little tight at first, but they're designed to move your teeth to where we want them to be 2 weeks from now. And so each set, again, is changed about every 2 weeks.
Wow.
And the benefit is that we could help get your teeth in better alignment so that you don't have further chipping and fracturing, as well as you could take them in and out to brush and floss, so you could keep the lower front area cleaner. And then once we're finished, those teeth would be straightened and the space would be better. You'll be able to floss and be able to keep things clean.
Okay.
So
that would solve the problem you talked about earlier?
definitely, it would solve both of those problems. And so we'll get Dr. Hodge in here to do his exam, and he can give you some more information on that.
Okay, thank you.
Okay, do you have any other questions?
I think that's all.
Okay.
I appreciate it.
Thank you. You're welcome.
Did you notice how she transitioned from Terry's crowding problems into how simply she could address those problems by straightening his teeth? She uses a hypothetical discussion of how Invisalign would work for him, allowing him to imagine himself accepting treatment while overcoming some popular objections to braces with reassuring details. We'll talk more about that in a little bit. Right now, let's see how she addresses Terry's issues and describes how Invisalign would help.
Well, I'd like to introduce you to Dr. Hodge.
Hi, Terry.
Hi, Dr. Hodge.
Good to meet you. Thanks
meet
for
you.
coming in today.
You bet.
So how'd you hear about our
I
practice?
found you on the internet.
Great. It's amazing what all you can learn on Google, isn't it?
Yes.
Well, looks like you and Brandy been quite busy. Looks like you got photographs, x-rays, the works. So I'm gonna let her kind of fill me in what y'all have already been talking about, and you and I can get better acquainted.
Okay.
All right, great. Brandy?
Sure. Well, we did discuss quite a few issues. One of the concerns that Terry had was a fracture. Does have a crown on a tooth, and we did talk about the wear, and then we also talked about bleeding and inflammation and some bone loss down in the lower front where he has some crowding.
All right.
And so when we were looking at the x-rays and doing the probing, I had recommended a deeper cleaning to get rid of the gum disease and get the gum tissues healthy. However, with those teeth being crowded, he does have a difficult time flossing there. So we talked about how Invisalign can help with both the wear prevention and just overall health of the gum tissues. And I think that is something that he's interested in.
Okay,
So.
great. Okay. Well, Terry, I tell you what, let me go ahead and take a look, and we'll compare what we see with them in the mouth with the x-rays and photographs and just see where the discussion leads us. Okay? All right, let me sit you back here, and we'll take a look, and let me get some gloves.
Brandy and Dr. Hodge work well as a team, gaining each other's agreement in the patient's presence, underscoring each other's professional credibility. Notice that Brandy gives Dr. Hodge a summary of what she spoke to the patient about. Again, this reinforces the problem, consequence, and solution to the patient.
Well, okay, Terry, now that we've taken a look at your teeth, the x-rays and the photographs, there's a couple things I'd like to mention to you. First of